Hi, I'm Freya from Expecting. You may have heard the term induction, and we're talking about inducing your labour, so starting your labour off. And there's 3 reasons that we might talk to you about inducing your labour. The first is when you go overdue. Now, you don't have the gestation of an elephant. At some point, your placenta will give up and stop working. Now, the placenta is what feeds your baby, so it's really important that we would induce you before that happens. And we'd normally induce you around the 10 to 14 day over your due date mark. The second reason might be that you've got some kind of underlying medical condition that you had before you were pregnant, or a medical condition that you've developed during pregnancy, something like your blood pressure creeping up, or that you've developed gestational diabetes. Then the doctors will assess whether it's safer for your baby to stay in the womb a little longer or safer to be born, and that's a reason we'd induce you. The third reason is if your waters break. Now, your baby is in like a balloon, like a bag of waters, and if that gets broken, there's a risk that they could develop an infection. So that would be a reason that we would induce you. So hospitals will vary very slightly in terms of when they induce you or quite how they do it, and they'll communicate this with you. But I'm going to give you an overview so you know what to expect. First of all, when you come into the hospital, your baby will be monitored, so they'll check everything's okay to begin with, and then they'll examine you, a vaginal examination. So that's 2 fingers just to assess the cervix, and that's the neck of the womb. See what it's doing before they actually start. Now, by doing that, they'll be able to make a decision of whether or not they can break your waters. If they break your waters, this usually releases a hormone which helps kickstart everything. And you may find that actually labour progresses normally and naturally by itself and they don't need to do anything else. To actually break your waters, when they examine you, they slide what we call an amni hook. And it sounds worse than it is. It's like a thin sort of stick with a little hook on the end. They just slide it between their fingers and break your waters. Now, usually it's not much more uncomfortable than when you're just having an examination. So if they break your waters, that's great, then they'll wait and see what happens. However, they may find that when they assess you, your cervix is shut. It's kind of like this. There's no way one of those amni hooks is going to get through that. And if this is the case, they would then offer you a pessary in usually gel or tablet form. So this would be inserted into the vagina just to sit below the cervix. And this releases, it's like synthetic hormones. And these actually help to soften or ripen the cervix to encourage it to open, so that then you get to the point when you can have your waters broken. When they insert the pessary, they'll normally get you to stay on the bed for a good hour just so it doesn't fall out, or to allow it to start working. And they'll usually monitor the baby in this time. You may find that nothing happens, or you may find you start to develop sort of period type pains and a few tightenings. If not a lot's happening, the midwives will then re-examine you 6 or 8 hours later to see what the progress is. And if internally they can break your waters, great. If not, they're likely to repeat the process with another pessary. And this can go on for 1 or 2 days. It's important that you recognise that your baby is unlikely to be born the day that you're induced. If they are, it's an absolute bonus. Now, if they carry on this with the pessaries and nothing happens, the only option then eventually is that you'd have to have a caesarean section. But if they are able to break your waters at some point, they'll usually wait just a couple of hours to see what's going on, see if your body kickstarts everything. And if still nothing happens, there's the option of a drip. Now, this would be the option if your waters have already broken anyway. If your waters have broken, however, they may have broken higher up, and the midwife might still be able to break them lower down at the opening of the cervix. So if they start talking to you about the drip, it's usually done in the back of your hand, and this is syntocinon, again another hormone that actually forces your uterus to contract. So it's kind of got no choice at this point, it will start to contract. And we give it to you very slowly to allow your body to get used to it, and then we increase it to encourage those contractions. We monitor your baby closely while this is going on. Now, when people are in labour, they sometimes talk about a pain ladder. And what they mean by that is that they kind of climb up the rungs slowly as the pains intensify. But people sometimes find that when they're induced, that they feel that they're thrown up that ladder a few rungs at a time, and it can suddenly become really intense. Now, this isn't everybody's experience, but if you do find this, just be aware that there's lots of pain relief available in the hospital for you to have, and you're not going to get any medals for refusing it. If you found this information useful and you'd actually like a fully comprehensive antenatal course to prepare you for labour, birth and for early parenting, then check out expectingclasses.co.uk.